All right, so I will call the meeting to order. And our first agenda item is approval of the February 15th Zoom video as meeting minutes. As a reminder, the voting members at this time are Kristen, Melissa, and myself. So I will make the motion and I'll ask for a second.
This is Melissa. I can second.
Thank you. All in favor?
Aye.
Aye.
All right. Our next agenda item is election of new board members. I sent out the CVs or resumes for both of our candidates who will be joining us next month. So I will make the motion to approve April Mickens Jolly and Brittany Jones as two new board members to join us next month. Can I get a second?
This is Melissa. I'll second.
All in favor?
Aye.
Hey, Serena, could I ask real quick, am I a voting member still?
Not still, because you turned off last month.
Last month, okay, that's why you said that. Okay, never mind.
All in favor?
Aye.
Aye.
All right, and that's no opposition and no abstentions. And then our last agenda item for a vote, well, actually two. The waiver of the 60-day nomination period for board officers. So our bylaws include a requirement for a 60-day nomination period before a new board officer can be elected. However, we are behind schedule. So we're asking to waive that 60-day nomination so that we can elect our two new board officers. As Tim just mentioned, he turned off last month and I'm turning off this month. So we're first going to request the waiver of the 60-day nomination period. And just so folks know, we don't have a field of candidates. We have one candidate for each office. So I will make the motion to waive the 60-day nomination period. Can I get a second?
This is Kristen. I'll second that motion.
Thank
I
you.
beat Melissa this time.
All in favor?
Aye.
All right. Abstentions, opposition, none. And then our last agenda item is the election of new board officers. So we're going to do these one at a time. I am making a motion to elect April Mickens Jolly as the board chair. Can I get a second?
Second. It's Melissa.
Okay, all in favor?
Aye.
I see Kristen's mouth move. I just didn't hear her. All right. Thank you. That passes. And then I'm also going to make a motion to elect Kristen Simpson as the board vice chair. Can I get a second?
Melissa, I'll second that.
Thank you. All in favor?
Aye.
Kristen, you have to vote too. I know it's for you. But...
Oh, okay. Yep. Yes. Aye.
All right. Thank you. So that concludes all of our voting items. Again, Dr. Tepe, thank you, thank you, thank you. And we will move to our next agenda item, which is not a voting item. It's a discussion item. So at our last meeting, we talked about the need for animal care and control building. And everyone is very interested in figuring out how the board can support the Department of Health staff in securing a building. So I'll give a kind of a high-level overview of what the issue is. And of course, Dr. Mahdi can jump in with more color and detail so that all of the new members know what has us so motivated to assist with this issue. But essentially, for the past 2 years, Dr. Mahdi has worked to rebuild the staff and infrastructure for animal care and control. When she took the helm of the health department, that specific division was understaffed and under-resourced. I think they had like 3 animal control officers or something. 2, very small number, not the number that they needed. And over time, she's built up to be fully staffed. And now their issue is that their building isn't adequate to actually care and control for animals, to the point that it could possibly be shut down by the state by not meeting the requirements for health and safety. So they've been working very diligently to try to obtain a new building. A part of the barrier is funding. So there is an opportunity for advocacy with elected officials, with the mayor's office, to really impress upon them the importance of securing this building. They do have a nonprofit partner that is also assisting with raising awareness about the need for this building. And in our last meeting, we discussed ways that the board could be involved to really advocate for this. So one opportunity is to, of course, reach out to the electeds in the area where you live, or if you have relationships with the mayor's office or other folks who have control over budgetary decisions, to kind of reach out to them. We have prepared some draft letters and a packet about the needs for that building. There are very specific needs, of course, to meet the requirements for health and safety that you can send out. Another thing is to just do general advocacy. So within your own networks of influence, to let people know that there's a need to raise visibility. There's a letter for that, so that you could prompt other people to reach out to their elected officials and then reach out to the mayor's office. And that's more general. And then for folks who have relationships with people who might have access to buildings or who might be in real estate, to actually make contact with those individuals as well, so that we can advocate for specific buildings or support with building out infrastructure that might be needed in a building that we secure in the future. So those are the three pathways. Those are the three letters. I created a spreadsheet. It's a Google Doc. Everyone after this meeting will get a link to that doc. And in it, we're just asking you to keep track of who you've contacted. It also allows us to see what's already been done. So the staff also have access to that spreadsheet, so that we don't have 5 people contacting the same person and looking like it's kind of, uncoordinated. So the request for the board is after this meeting, you'll get the letters, you'll get the link. If you have folks in your network that you can do outreach to just keep us apprised of who you're reaching out to, what kind of responses you're getting, so that we know how this is moving along. And I'm sure at some future point, we'll get kind of another checkpoint on where things are with the building. I believe this is a decision that we're trying to push before the end of the fiscal year, while they're making budgetary decisions, which is pretty much this month and next month. So if you are able to lean in, this is the time to actually get involved with that. Dr. Marty, did you want to add anything on the building?
No, I want to say good morning and welcome to all these new faces. It is such a pleasure to see this board grow. All of you are such respected members of our community, and I just want to say how grateful I am that you took on this charge. This is a very near and dear topic to my heart, and has been a really difficult space for our health department. Serena will be talking to you about upcoming board training. And so I'm sure you have a lot of questions. So many of you are involved in the space of public health, so I hope not all of what you hear will be new. But this will be, but animal care and control, when I joined, had, as Serena said, literally 2 officers for the entire city. So anything that had to do with animals for the entire city of St. Louis, we had 2 officers. It was horrible. And this is one of the most difficult areas to train. It takes 6 months of onboarding. It's also very dangerous, right? They're called into attacks, animals that are unsafe, and literally put their lives on the line and their health on the line, and have endured, many of our officers have endured some pretty scary things. And so this, public health is on fire. When you get to know me, you'll hear this spiel in my soapbox. But we are under prioritized globally, nationally, and definitely Missouri being the 50th out of 50 states in per capita spending on public health makes it really difficult for me and my department to do the work. Yet we have grown 31% in 2.5 years. Yet we continue to do this work, and yet my folks show up every day with a smile. As far as this topic goes, if we do not get a big building, a new building, child, you know what? Let me keep big in there too, because y'all do your work. Let's go for new and big, right? we'll get shut down. And that would be such a disappointment because in my 2.5-year tenure, we now have 11 animal care and control officers. We have a supervisor. We have better fleet of cars. We're still advocating for better cars. We are doing advocacy. We're doing education. This all would have gone to waste. It's unprecedented growth for animal care and control. And so we really need you to lean in. I need new board members to use their excitement, your new energy, to please use your networks and folks who care about this to really spur this conversation on. We've been working with the mayor's office for a year. And we are still not at the finish line. So anything you can do to really show that you think this is a priority, but to also link us with folks who may be able to help would mean a lot to us. Happy to take a few questions here. The letter that you'll get from Serena will lay everything out for you pretty clearly. But if there's anything I can field right now to help you, as I can tell from your faces, you are going to be so enthusiastic and passionate about this. Yes, you are. But are there any questions that will help you as you have conversations? And I would advise you to also watch, it was last month's board meeting, Serena. Last month's board meeting, all of them are recorded. I can actually ask Rhonda, if you can just make a note to ask Shantae, if she's not on, to please send last month's video to all of our new board members. You can actually hear from the animal care and control team. They give you a little overview about their work, all the things they're working on. That could help you with talking points, but I'm also happy to field any questions.
Yeah, I think sending the link to that video will be excellent because it's not as easy to navigate the YouTube page.
Hey, Dr. Brady, if I could, real quickly, and I appreciate your enthusiasm and welcome again to the new board members. And maybe that's in that video or your many wonderful reports that you put out, and I can go look at that. But I know you can do this, or maybe you can off the top of your head with the increase in the staffing from 2 to 11, I think you said. Has there been a noticeable improvement in sort of what in outcomes?
It's been
way to put
stunted.
it. Go ahead. Yeah. So
That's a great question, Tim. I think, unfortunately, the metrics are multifactorial, and one of them is that we have one shelter provider, and being in this old building makes it difficult for those metrics to really thrive. So it's really hard. These folks have clearly increased their ability to respond, but our ability to actually house these animals and for these animals to have a good quality of life. I've done a tour of the shelter, and it is heartbreaking. It should only house a quarter of the number of animals that are in there, and they can't keep staff. Staff find it so stressful. They have a volunteer system which does not serve these animals well because these are folks that are constantly being onboarded and the turnover is really high. So the shelter provider can't provide the quality of care. So Tim, I believe that you can see the increase in metrics in what we do on our end, but the overall metrics don't budge because of this building issue, right? That shelter serves as a space for serves as a space not just for housing animals, but to rehabilitate them. This is where they get their medical care and being able to get them adopted. And unfortunately, when we're not able to do that, we see the rates of euthanasia of animals increase, which is devastating as well. And so, no, my friend, we are, and the burden on the animal care and control officers, where they know the quality of their work and their training has exponentially increased, but then on the tail end, where the outcomes really matter, those numbers don't budge because of the situation with the shelter and the quality there within.
thank you so much. Well, that's not pleasant news, but it's what people need to hear in order to know that we need a building.
And thank you to Rhonda, who just dropped the link for the board meeting that I just discussed. If you could take some time to just copy that and put it in open a new tab so that you can come back to it and watch it. You can just briefly go to the section on animal care and control. It's no more than 10 minutes of your time. So appreciate that. Any other questions or comments?
I have a quick question. Specifically, are you looking for spaces, dollars, both of the above? I just want to be clear on the.
Yeah, so unfortunately, the Department of Health is not a fundraising entity, so I can't just do a fundraiser. I actually think I'd be really good at it. It would be chaotic, but I think I'd be really good at it. But the charter does not allow me to do so. So we would need creative ways. Folks who are willing to either donate a building or work with the mayor's office if they do have funds and they don't have space. The mayor's office can definitely help, knows all the ins and outs of what is permissible and how to do that. But the ultimate goal is a building in whatever way folks can get there. So connections, high-powered connections are always a great thing, right? Funds, and those, we can link you to the mayor's office who would then take it from there, or actual building space. And I don't know, Serena, if the final letter has the specifications, but I can also forward the email to board members. It talks, that gives some guidelines to what a building needs to be like, because we can't just move these animals into any old building. It needs to be buildings that have a few specifications that they can work with. And the city is willing to invest in reconstruction, so it doesn't have to be a perfect building for animals, but it can't be completely prohibitive. It's a great question. Thank you.
So there's an information packet that goes along with the letter that has the details on the building. And I think the way to approach this is to really put some pressure on the folks who control the budget for the city.
Yes.
That this should be a priority. And then from there, for folks who have access to real estate to make those connections, we're not really trying to it's not a capital campaign where we're trying to raise $1 million. However, if you have folks who can contribute, we do have mechanisms through the city's office of the mayor to the mayor's office, if that becomes, something that bubbles up. But it's really about pressure to put it in the budget and then finding the right building.
And some of the buildings we've looked at, it's ended up being the price tag that was too prohibitive for the city. So upwards of $9-10 million from a purchasing standpoint. So again, if there's folks that we know in the real estate space that could help with even better pricing for the cities, there's a lot of different ways to do this, but I would really listen to what Serena said. Budget season is now. We're actually a little bit late. So that positive affirmation, that making it clear to the folks that make decisions about the budget would be key. And then moving from there with, your actual connections around the building. But I think that strategy is really the best way to go.
All right. And so this is my last meeting as chair, so you probably don't need to know this about me, but I'm always right into the agenda, and I appreciate Dr. Mahdi always being gracious and welcoming, and we should have done introductions and all of those things to get everybody grounded. So you won't have to tolerate my lack of etiquette beyond this meeting. I'm going to pass it over to Dr. Mahdi to get to our next agenda item.
Again, a hearty welcome, and you should probably watch all of the last meeting because it will really make you see how much we care about and are so thankful for Serena's leadership. It's a really emotional time. A lot of joy in seeing faces that a lot of us know in the public health space and respect. So happy to see you here. But losing a leader is hard. So Serena never has to apologize to anything from me because she's exceptional. And we're so grateful for everything you've done. Again, it's tough for new members because we want to wait until all the new members are here to do more of an orientation. So please bear with us. This meeting will be a little bit feeling like a fish out of water and like it's business as usual. But please know that we have been really proactive about trying to get some training through the state and then through our own Department of Health departmental leaders. So that is coming, just hold on. What I am going to do now are departmental updates. And so I will do a preview of, this will help with a little bit as a preview for training. So by way of background, sorry, I can't talk and do things at the same time. So let me just get these slides started and then I'll keep talking. So by way of background, when I first joined the department, I really felt like health literacy, both at the public, even for people that know about public health in political circles and certainly for community, was exceedingly low. Anytime I give lectures, I do a lot of teaching in community. When I ask people, do you know where the health department is? they don't know. And I'm really hoping that every member of the board does know, but if not, do a quick Google search and sear it in your mind, because you're now a board member and you should know where we are. But people don't even know where the health department is. If I take it a step further and I ask young people, well, what kinds of things do you think the health department do? They have no idea, right? So the health literacy issue is low. And I just felt like one of the things that I wanted to bring as a part of my leadership legacy is just better understanding, dialogue, and education around public health. So we developed some very basic metrics. We're actually excited that we're going to be putting out an RFP for a consultant to build more formal and stronger KPIs for all of our departments so that we can continue to track progress in a way that will grow the department. But there was nothing like that when I came. And so we now have a monthly report, and we've done 2 annual reports since I've been Director of Health. They're impact reports. Rhonda, with Kim out, I would really appreciate it if you could put the link to the last impact report on our website in the chat. This would be a really nice way for you to do a very brief overview as part of the beginning of your training, is to look at the last 2 years' impact reports. They were the first. Our team does a beautiful job. I want to give credit to Aaron Ford, who's not on the call today, because hopefully all of you are joining us at Missouri Foundation for Health at noon today for the first ever Regional Maternal Child Health Department of Health summit and discussion. It's going to be beautiful. We're catering lunch for you. So even if you don't want to come, because I know the spirit of the flake is high with very busy professionals, as all of you are on the call, but I'm wooing you. You get to see and meet in person your new board members. Whoop, whoop. You get to have a free catered lunch, and you get to talk about one of the biggest crises that our state consistently has had, and the metrics for which are worse, and really get to network and hear from the leaders in our region. So I'm really excited about that. So our communications team is prepping for that. So I'd just appreciate that link in the chat. I usually focus on one area, but because we have new board members, I'm going to do a brief overview. You will get this monthly report at this time every month, every 4 weeks from now. And unfortunately, my team it's too much work to put together for them to do it and get it to you before the board meeting. But I usually do a discussion focusing on a point, and we can ask questions and zone in on that. And then you get the full report. This board has become very active. So no pressure, but pressure to the new board members, because it used to be, sort of a conversational board. This is now a very active board. I like homework. I like for people to push us to really read, ask questions. We've built relationships. Kristen Simpson was here just a month ago with my team, sitting at a board table, really pushing the barriers and teaching them about the incredible work she does and the importance of CHWs. And we hope to do the exact same thing with all of you. But this is the way to get dug in and really figure out what's going on. So it starts with a little intro from me. It gives you a piece about, just what's been happening in the month before. So for whatever month we're in, you're seeing data that reflects the month before. There's a few slides that help with forecasting, like events that are coming up, but as far as the data itself, it reflects the month before. This is for folks who are busy, but I hope everybody comes back to the report. But the high impact things, what are some of the 3 big things to look out for that we thought were important? So this month, our Communicable Disease Bureau hosted some successful STI and HIV testing at SLU and Harris Stowe. Our team is really active in community. We have just over 131 employees, of which I'm very proud. We had a turnover rate of over 40% my first year. We were able to get that down to 22% my next year. And then last year, we got it down to 8%. So we have now grown the department by 31%, and it really shows in the way that we show up in community. We are really pleased to announce that we have a new chief medical officer. This is a new position. Could be confusing to some of you because our department actually has no clinical services, something that I'm also looking to bring back in the next couple of years. We will have an RFP out this year to look at what that could look like in a healthy way that honors the work of our incredible FQHCs, but puts us in a position to meet the gaps that exist and to really serve as a fully functional health department. She's the first step towards that, but her job is really here because of the crisis that we're experiencing in city jails and the City Justice Center. For the first time ever, the health department has finally been given medical oversight and evaluation of medical services. So I've been doing that since really I started the work in October, but there's a new contractor that we brought in December. Where we have monthly reports in the jails now for the first time around medical oversight, and we're bringing in the national accredited entity. So this CMO will be building a small but mighty team and also helping predominantly with that oversight. And then the few areas where we do have clinical intersection will also be under her jurisdiction. So she's in the onboarding phase. She's been here for 3 weeks now, is meeting and greeting and training and learning and absorbing and already throwing herself into the work. She has a very incredible background in mental and behavioral health. She's a licensed psychiatrist, has worked in jails, and previously worked at Aetna at a national level as well in Medicare and Medicaid work. So just a lot of experience here that she can bring to the city. And then I was with the OG. If you don't know who Miss Ollie May is, that's another part of your homework. Knowing who the leaders and in public health are, especially in Black and Brown and minoritized communities, is essential. Miss Ollie May is who I refer to as a mentor. I refer to her as the OG. She is upwards of 90 and still one of the most active people you'll ever meet. She has advocated for public health, but specifically for the care of our elderly citizens for decades. And is when we like to talk about trusted messengers, you're looking at her. So she had a Black History Month program, and it may have been one of the biggest honors of my career for her to ask me to serve as her keynote. So that's how important I believe she is to community and to me specifically. So we honored her with a proclamation. There is now a Miss Ollie Stewart Day in the city of St. Louis. The theme was the history of gospel. It was just a beautiful, beautiful time, and I hope to be able to introduce you to Miss Ollie May and for you to intersect with her. During respiratory illness season, we have kept a dedicated section on the monthly report to just give you updates on the 3 main respiratory viruses that we've been tracking: COVID-19, influenza, and RSV. So influenza numbers have been rising over the last month. This is the first couple of weeks where we're starting to see a downward trend, but we do have for the first time this season 2 confirmed flu deaths, and it should be no surprise that both of those people are in the over 65 age group. So we are still pushing people getting vaccines. Shout out to our communications team who have been doing a phenomenal job of videos, commercials, social media presence, really educating the public. We give you some updates on COVID-19 and RSV as well. So you'll see some of that data. Then the rest of the report is each of the bureaus get their own section. There's 2 attachments that you'll get. This is the flowery. So if you're more of a visual learner, this is sort of the pretty newsletter-esque one. But then there's a written narrative that has hyperlinks so that you can go to sections that gives you a little bit more meat to this. So for the behavioral health, the substance abuse overdose, we give you some numbers there. Compared to the first 2 months of 2024, EMS has seen a 27% decrease in calls for overdoses and hospital emergency visits, have also seen a 10% decrease. So numbers tracking in the right direction there. We also give you some data around suicidal ideation. And then the Behavioral Health Bureau has only been a year old. This is something that was important to me when I came to the city of St. Louis. We didn't have one person hired to do the work of mental health or behavioral health. And so I advocated for a new bureau. We first did it by laying the groundwork in a 1-year partnership with the CDC, who gave us 7 salaried employees to bring a strategic plan, an implementation plan, a health equity plan around mental and behavioral health, and the beginnings of a dashboard. And now we are over half of the year into the bureau itself. They are hiring machines. I think we're upwards of 12 people now that have been hired. And so they tell you a little bit about what they're doing. And as you can see, they distributed 322 Narcan kits throughout the community in the last month, provided for training courses. They're in the city jails right now, which is why they're not on the call. They're training folks in the jail around mental and behavioral health. So Dr. Julie Gary and her team are incredible. And we're also really excited to announce that we have partnered with 2 St. Louis public library locations who have agreed to put Narcan boxes in their location as well. So really normalizing Narcan in community and using educational spaces to further educate the community. The 988 education campaign over the last year has really bolstered that, and we got some feedback here. I told you this is an active board. So our board chair told us that she gets a lot of feedback that people don't know your bureau, what they do, where they're going. So we are holding people accountable. We've been going to wards and taking pictures with older people to prove that we have been in their offices. So we have been, Alderwoman Pam Boyd hosted us, Alderwoman Ann Schweitzer, and others. We are now going from ward to ward. We've met with almost all the older people. We're still scheduling meetings that are 2-hour meet and greets. The department really orients them, and then we get Narcan boxes out. Communicable disease is another section. This is what people usually think about with the bread and butter. Some of the metrics we choose to share with you, because we have limited space, obviously, is what we're doing around hepatitis B and our TB work. We have a small clinic for TB and refugee health housed in Affinia downtown on Biddle Street. So we tell you, we've really increased our activity in the TB space, the number of clinic visits and the tests we're providing. But I've really pushed our new nursing supervisor, Tracy Campbell, who's incredible, to really meet with refugee and immigrant health leaders across the city, develop stronger relationship, and come up with innovative ways to meet people in community. So you can read more about what's happening in communicable disease. The other big area that shouldn't surprise you is obviously HIV and STI health. And so we do have a small health stop clinic here at 1520 Market Street in our building that provides free testing to folks. But because of the lack of clinical services, the rest of our work is really around linking people to care, which they do a beautiful job of. I'm so sorry. So again, I'll let you get into the numbers here. Our family, community, and school health is the next department. Here you'll see a lot around what they do with schools. They have nurses who work with all of our schools. The lead remediation is a huge part of what we do, and you can read more about that. And they also have some incredible programs. So the maternal child health you'll hear more about today. When you leave your offices, drive down to Missouri Foundation for Health and eat a delicious lunch with your new board. Such an exciting time that you will have today. But they also have some programs that will let you know what they're doing. Their focus this week is they really want to talk to you about a campaign that they're doing around maternal child health and getting the message out specifically to minoritized and young folks in this space. So you'll read a little bit more about that. Environmental health is our next bureau. It covers a lot of sections: community sanitation, food and beverage control, air pollution, you heard about animal care and control as well, and then emergency preparedness. So you can read more there. And the numbers, you can see a lot. Tim, you were asking about metrics. 52% increase just last month because of the new hiring in service requests to animals. And then unfortunately, however, that gets blunted, like I said, by the metric right below it, 0 average daily animal intake, because the shelter and rescues are over safe capacity and had to close down their services. So again, we're now having to redirect animals to other shelters. That puts a big burden on them. They are very unhappy and really, send me a lot of very strongly worded emails. But we're in a rock and a hard place, because without a new building, this is what happens to those metrics. So they're working overtime in the city, and then the daily intake is completely stunted. So again, you'll get that packet from Serena later. Please, please, please make this your #1 priority to try to be thoughtful about where we can go. Really proud of the work that we've done in health promotion and education in the last 2.5 years. Increased community engagement and metrics over all our social media by 300% in my first quarter. And that may sound frivolous to you, but this is where people are. People are scrolling on their phones and on their computers on social media every day, like throughout the day. And so I want everyone to get out their phones, all new board members, and I want you to pick one of your favorite social media platforms and follow us right now. So you can pick LinkedIn, you can pick Facebook, you can pick Instagram, you can pick Twitter or X, and it's at City of STL DOH. I think I had that right. It's the same name on all those platforms. But we keep metrics on this, and the public has come to. I remember when we told the public we were going to go from weekly COVID reports on social media. They knew every Thursday morning they would get a report to monthly or stopping it. They almost lost their minds. In fact, when the pandemic task force stopped, we started getting letters that we better not. So there is a group of people who are invested in public health. I also commit to an urban radio station every Tuesday at 9. Our team is just very active, but health and promotions is more than just that. It's educating the community. It is press releases. It's events like the ones that you'll come today. So they are really phenomenal. There's a new manager, Shantae Fluellen, who's also expanding her role to really have a strategic approach to community outreach. We were able to purchase 2 mobile vans through ARPA funds, and they will be out in community within the next month. And Shantae will be right back here to talk to you about her strategic plan in the next couple of months as she rolls that out. So you can read more about that. So if you're falling asleep, this is where you wake up again. This is an active space for you every month. We put every single current job, and then in the narrative, you can copy and paste it into emails and send it out. We lifted the 100-year-old charter that has never been amended. Let me say that again, 100-year-old charter that has never been amended, made it so that we could only hire people who lived in the city. We couldn't hire people from the county or people who live just across the way in Illinois that can drive to my department in 20 minutes. Fortunately, the governor was able to lift that at a state level. So now we can hire people from anywhere in the region, and Department of Personnel is even working on more longer distance people for jobs that work for that. So please let people know about these job openings. Just look at this list. It's a wide variety. We're looking for contract compliance officers, environmental health officers, health marketing administrations, nurses. We're looking for managers, public health folks, and secretaries. So there's a lot of folks, and a lot of you are actually in academic spaces where people are looking for jobs. So we'd really appreciate you every month, like pushing this out. And Shantae and her team in the narrative form make it easy for you to put the link and everything all nicely packaged. And then this is another way for you to get involved and show up for us and in community, show your face, meet the team, is we give you all of our events. So there's no excuses, right? In green, oh my goodness, what a surprise. What is the first one? Oh, is it the lunch today? The catered lunch for maternal child health that I will see all of you at? It sure is. There it is, bolded for you. But the rest of March and even April for forecasting is also in this monthly report. So we literally make this easy for you and spoon feed you. I hope this has been a helpful beginning overview. Please copy and paste a new tab for the last impact report that Rhonda so graciously put in the chat for you. And I am happy to take any questions now. And I'm like this before coffee, folks. Imagine what it's like after coffee. It's a lot. It's a lot.
Their meetings, Dr. Mahdi, lots of energy. Any questions? Oh, Tim.
I was just gonna say, you must have had a good cup of coffee this morning, my friend, but you always have that energy, and I'm gonna miss that. Maybe I can find a way to.
Letting you go, Tim. You know I'm gonna be stalking you, using you, inviting you. You never leave the Board of Health.
There you go.
We're family forever. But no, my toddler was up at 5:30 this morning, so my day started really early. She started this new delightful day, waking up at 5:30 and waking up the whole house. So that's
there you go. And she's a cutie, I'll tell you. So so I got a question about the jail. And there's you know, it's God bless you for taking on that challenge. And yeah, I think I've told you that I'm on the Justice Services Board for the county, where they have you know, a lot of good health services there. And you know, real quickly, I should know this. I'm sorry, how many residents are there in the jail?
I don't know off the top of my head, Tim, but I'll send you those numbers and I'll circulate them on the board. We'll be able to, we're finalizing our first iterations of the reports for the jails, very rudimentary, but will allow us to hold folks accountable and track progress. They're dealing with a really heavy backlog from the last provider, unfortunately, before Health and I was involved. And so this new provider is doing a great job, but there's a lot of staffing shortages. If you're reading the news, nursing availability for services right now is at a low level. So we're even having to work with an agency, and the agency is having a tough time sending us nurses. So just doing basal work has been a challenge, but I'll get you the number of the inmates, and then you will start to get more numbers from the reports that we're doing. And I'm looking forward to NCCHC hitting the ground and starting the report.
Yeah, and I'll look forward to getting those, and I hope I can stay on your mailing list. But you know, one of the things that I think we learned in the last 3 or 4 years, we've made significant improvements in the county, is, you know, there was definitely a correlation between improving people's health and reducing the number of unrest incidents. You know, if you take care of people, I mean, this is not rocket science, it shouldn't be rocket science, but if you treat people like human beings and you give them health care and mental health care they actually, not all the incidents go away, but they actually, there's not as many times that they beat each other up or go after the officers and so on. And so I think, if you want to reduce those number of incidents, the mental health and the health is really important, I think. So.
Agreed.
Okay, other questions? Thank you, Dr. Mahdi, for the report. So our last agenda item is about board orientation. Next month, in place of the regular board agenda, we will have an orientation conducted by the state of Missouri. So show up at 8 as normal, and the orientation will take place during the meeting. It's about an hour. The content of that will be focused on what the board needs to know to assist with the accreditation requirements that are set forth. It's not necessarily specific to our strategic plan and our goals for the City of St. Louis Department of Health, but we're going to complete that training first, and then there will be a supplemental training that's specific to this board. One thing to note is we do have committees, and we typically assign committees after folks have gone through an orientation process. What I'm going to do is work with the incoming officers to make some recommendations around committees. But one of the reason that we choose to wait until after the orientation is because we want you to get more information about the different lines of work that are happening, the goals of the strategic plan, so that you can then decide which committee makes the most sense for you based on your interests and your expertise. So we try not to do arbitrary assignments. I will say that everyone was nominated by someone, and for some of you, they've already told us, this person would be great on this committee. So we kind of have some ideas of what the folks who nominated you thought you might be interested in, but you're not obligated to, choose those committees. But we will, again, just kind of say, here's what we're recommending, here's what we think, and then you'll have the ability to accept or decline after you have more information about what each committee works on and what the overall strategic plan is. As a reminder, I think I've sent this out in a few different emails, but the process that the mayor's office is using is you have to have a completed application and nomination form. I think they're waiting on all of them to be done at the same time before they start sending out letters. So once everything is kind of in-house for them, they'll send out your letter from the mayor's office, and then you can be scheduled to be sworn in. We will have a few more openings. So whoever joins the governance and nominating committee will have the ability to start the recruitment process for additional members throughout the year. All right, are there any questions? If not, our only announcement is that the next board meeting is on April 18th. And welcome and good luck. Good luck and it's not an ominous thing. Sorry. I saw Elizabeth's face. All right. Thanks, everyone. We're adjourned.
Thanks, everybody.
Thank you.
Take care. Good luck or whatever.
Thank
You'll be great.
Or whatever is my new favorite.
I love it. Thank you. I'll see you next month. Bye.
Nice to meet you, Elizabeth. See you later.
We'll stay in touch, Dr. Mahdi. So
Always my friend. I'll see you later. Okay?
see you. Bye.